Hi everyone, Felix here, Advanced Clinical Practitioner with Eden Clinic. Today we're going to be talking about the different testosterone preparations, or esters as they are otherwise known when you're dealing with injectable testosterone. Now this is a complex topic, so this is part one of a 3-part video series, so be sure to subscribe to our channel so you don't miss the next videos in this series. So let's get started then. Now, in order to understand the topic of esters, we need to talk a little bit about chemistry, I'm afraid. So we also need to discuss the pharmacokinetic principles required for understanding the choice of ester and the best administration route in the context of TRT. For more information on the pharmacology of TRT, be sure to watch our videos on that just here. Now, I remember when I was back at the University of Sheffield completing my master's degree in medical sciences and advanced practice that we talked about pharmacokinetics, and we were taught generally to remember it as 4 principles denoted by an acronym which was ADME or ADME, which stands for absorption, which is the process of the substance entering the blood circulation. Then the D is distribution, which is the dispersion of the substance throughout the fluids and tissues of the body. And then the M was metabolism, and this is the transformation or inactivation of the substance from a parent compound to daughter metabolites. And then finally, E was excretion, which is the removal of the substance from the body. However, when we're dealing with esters, there's actually a prior step before absorption, which is called liberation, and that is the process of releasing a drug from its pharmaceutical formulation. So the acronym in the context of testosterone or injectable testosterone for TRT is now LADME. So why do we need to add this stage of liberation? Well, to understand this, we first need to know what an ester actually is and why it's required. So it's chemistry time, I'm afraid, but don't get too alarmed. It's just sort of GCSE or high school level chemistry. Now, esters are chemically manufactured compounds that involve the reaction between an acid and an alcohol with the elimination of water. Now, water is formed as part of this reaction and is normally removed by a compound that is used as a catalyst to aid the chemical reaction. Now, in this case of esters, it's nearly always sulfuric acid. It's used as it's the perfect catalyst for the reaction, and it simultaneously removes the water. A little bit of pub quiz trivia for you is that these reactions are often referred to as condensation reactions, as they nearly always produce water, or they always produce water actually. So, moving on. Why do we need an ester in the first place? Well, to understand this, we need to mention some fundamental principles of pharmacokinetics in more detail, and these are the dose, so the amount of the drug administered, the dosing interval, so the time between drug dose administrations, the Cmax, which is the peak plasma concentration of a drug after administration, then Tmax, and that's the time it takes to reach peak plasma concentration, then the Cmin, which is the lowest or trough concentration that a drug reaches before the next dose is administered, then volume of distribution, and that's the volume in which a drug is distributed, very self-explanatory, the concentration, so the amount of drug in a given volume, and then elimination rate constant, and that's the rate at which a drug is removed from the body, and then this one's important, elimination half-life, and this is the time required for the concentration of a drug to reach half its original value. And then clearance, which is the volume of plasma clear of a drug per unit of time. And then bioavailability, which is the systemically available fraction of a drug. That's about it. There are a couple of others that are interesting and involved in the process, referred to as EC50 and IC50. So EC50 refers to the concentration of a drug that gives half its maximal response, and IC50 refers to the concentration of an inhibitor where the binding is reduced by half. But now we're getting into the realms of receptor binding affinity, and that's a subject all of its own, and a rabbit hole we really don't want to go down right now. So essentially, the pharmacokinetic profile of the different esters is based on the principle of mass balance, and that's the rate of change in serum testosterone level is equal to the rate of secretion and absorption minus the rate of elimination. Now, the reason I mention secretion is due to the use of HCG in some treatment regimes, which has been shown to preserve the function of the secretion of intratesticular testosterone in patients, which theoretically could facilitate the use of the minimum effective dose to yield the best outcome with the lowest level of negative treatment effects, or more commonly known as side effects. So, all medications will have their own peak plasma concentration, or Cmax, and elimination rate constant, and therefore their own elimination half-life that is specific to them. This is also true of testosterone and its different preparations, from different ester injectable preparations to gels, creams, and more. Now, in pharmacokinetics, there will be a point when the amount of drug consumed will reach a point of equilibrium with the amount of drug excreted, and this is known as reaching or achieving steady state. The achievement of steady state is pretty much the goal of TRT and most ongoing therapies, as this is otherwise known as normalization. So, getting back to why we need an ester, bearing in mind what we've just learnt about the drug half-lives, testosterone on its own, or we call that testosterone suspension, so simply the testosterone molecule suspended in water, has a half-life of around 2 to 4 hours. In other words, it's metabolized really quickly. Now, if we utilize testosterone suspension for TRT, we'd have to inject our replacement therapy between 3 and 8 times a day, and this just really is not practical. So the function of esterification, or the addition of that ester to the testosterone molecule, is to allow for an extension of the time the molecule is active in our body, or sometimes referred to as the time being systemically active. Right, that was quite a lot. I think we'll wrap up part 1 there, guys, as that was some fairly heavy information. Be sure to look out for when we release part 2, and I'll be discussing all the individual testosterone esters and looking at the action within the body and why some perhaps may be a better choice for those than others, and also looking at novel ways that things can be done to elicit the best outcomes on an individual basis. As always, if you enjoyed the video, please hit like and subscribe and hit that bell notification so that you don't miss any of our uploads, and I'll see you in part 2.